It's called the Lynch syndrome. Lynch syndrome, the other name for the Lynch syndrome is HNCC, HNPCC, hereditary non-polyposis colorectal cancer. Here you have autosomal dominant mutation of the mismatch repair gene. Same, we talked about it already. The MLH1, and the other one now new here is the MSH2. It's with subsequent microsatellite instability. So normally the DNA was, it was being copied, and mismatch was looking at it. Hey, you have recopied everything good or not? So when we have an instability that we cannot see if things have been copied nicely or not, that's the microsatellite instability. 80% of the cases progress to, so Lynch 80% is gonna go into CRC. They haven't mentioned which. Sporadic CRC. Sporadic CRC. Okay, it 80% goes into CRC. And what about the other 20%? That 20% is also going to go to CRC, and that is your serrated polyp. Again, same way. You have formation of serrated polyps, and that leads to CRC. That was the serrated polyps, which caused the CRC, and which also led to CRC. Okay, the important thing here is, which is also very, very important actually, to know the fact that hereditary non-polyposis. First of all, this means that it arises de novo. Meaning this guy, like the other ones are coming from forming the polyp. The polyp goes into formation of, depending on which polyp it is, can lead to formation of cancer, right? But this here, it's not through polyps. It's arising de novo and not through polyps. And de novo, it causes carcinoma. Okay, so the other way we can say it does not go through adenoma carcinoma sequence as well. Because remember, what was adenoma carcinoma sequence? That was, first you had the APC gene mutation that leads to formation of proliferation, and then you have the KRAS mutation, formation of polyp, and then TP53 mutation leading to formation of proper carcinoma. So it doesn't go through all of that. It is just non-polyposis goes into CRC sporadically. It doesn't follow all the polyp and all that thing. But proximal colon is always involved. Associated with endometrial ovarian skin cancers. Middle Lynch has CEOs. Okay, Lynch has CEOs. C for colon, E for endometrial, ovarian, and skin. Colon, endometrial, ovarian, skin, CEOs. Okay, Lynch has CEOs, great. Okay, and also one more thing here is going to be very important. That this is going to be your carcinoma which occurred at a lesser age. Starts as a lesser age. So carcinoma less than 50. With the microsatellite instability mutations. Hereditary gives us the clue that there is a family history present for any of this. So you don't have to have a family history of colon cancer. For CEOs, colon, endometrial, ovarian, skin. And the third thing they have mentioned here, which is the proximal colon. What is the proximal colon? That's the ascending colon, which is on the right side. So right colon is, or ascending colon, is commonly involved. Okay, so these are the some things to remember out of this. So now let's talk about in the next